Good morning. So, yesterday I had my first chemo infusion. I'm starting out with 4 dose dense AC chemos, and yesterday, like I said, was my first one. I went in around 9. First, I had to get lab work done, and so they drew blood, and then they also wanted to do an EKG. After that, I had to wait about an hour for the results to come in. And then at that point, I had to meet with my oncologist, and we talked a little bit about what the treatment was going to be like, and had time for any questions and a brief exam. I did ask her about my false nails. I wear acrylic nails, and I'd heard some people saying that you can't have false nails while you are on chemo, and I was fully prepared to get them removed if that's what I needed to do, or if having them was big risk or anything. And at least for now, she said, no, don't worry about it, it's fine. I'm like, okay. I've read some literature, and I've seen other people saying that their doctors told them they couldn't have them, kind of to avoid infections and stuff like that. If when you're getting them done, if you were to get a cut on your cuticle, or if the nail salon doesn't use properly clean tools, stuff like that, just to minimize risk of infection, basically. But she didn't seem to think it was anything I needed to worry about, so I'm gonna probably continue to get them. It's kind of a small treat for me. I've had them for so long. At this point, it would be weird to not have them, and I would have to get accustomed to having short nails again. Just the way a lot of people who have never had long nails say, I don't know how you do anything with those. This is the norm for me, so I operate normally with these. There's nothing that I can't do with these nails that anyone else does with normal length nails. Okay, all right. That's Soul, and he's a big boy. But anyway, so yeah, it doesn't look like I need to get the nails removed at this point. I don't know if it'll be different once I'm done with my AC chemo treatments, which again, I'm going to be doing 4 of those every other week. Once I get through that, I'm going to be going on to a different chemo, Taxol, and I'll be doing that weekly for 12 weeks. So the side effects for those chemos vary, and I have heard more issues of changes in the nail bed and nails potentially lifting up with the Taxol. So I don't know, once I go to that chemo, it might be, then it might be time to take the nails off. But we'll see. But anyway, what I really wanted to film this video for was because I am on day 2 after my AC chemo treatment. And going into it, I was extremely nervous, of course, like anyone would be, or anyone who's going to go through it is going to be. That's my baby, Zoe. She's, if you've ever seen any of my videos, she is usually right behind me. But anyway, I was very nervous, especially just having my port accessed for the first time, which is there. I still have the bandages on it. I've never had a problem with needles in general, or getting IVs or anything like that, but this, with it being on the chest, and it's just weird. having this thing under my skin, and it's different. And so I was very wary of that. But and I was recommended to get aspirin cream, like a lidocaine cream to put over it. They say like an hour before you start your treatment to numb the area. I put a few globs over it. I never really felt that it was numbing the area, so I can't tell you if it actually worked or not, because they also gave me ice to hold over it, and I felt like that was doing more than the cream did. But when they did get my port accessed and the needle in there, all I can say is that it was nothing. I mean, I felt when it happened, but like barely. Like, I mean, I've had IVs in my arm that hurt way more than that did. I don't know if it was because I used the cream. I don't know if it's because I used the ice. I don't know if it's because both. I don't know if it would have been the same result had I did neither one. It's hard to say. I have nothing to compare it to. But regardless, I now know not to be worried at all about that. So anyway, after that part, they started me on some IV fluids, and then I was given a steroid and anti-nausea medication through my port. And then they had 2 syringe fulls of adriamycin. I think I'm saying that correctly. The A in AC. The bright red stuff, what some people call the red devil, that was put into, like I said, a large syringe, and then they pumped that straight into my IV line that was connected to the port. So they did 2 syringes of that, and about 5 minutes for each syringe. They did it really slowly. Like I said, bright red, which is why they call it red devil, among some of the very unsavory side effects it can cause. But anyway, so once those 2 syringes were pumped into my IV, that's when they started the cyclophosphamide, the C in the AC. That was just in an IV bag and hung up, and I believe it was an hour for that to drip through. Then I think I was given more fluids, and they flushed my port out. They did that a few times while I was there, flushing it out. But here I am the next day, last night, and yesterday evening after the chemo, I felt fine. I was urinating quite frequently. I was trying to stay very hydrated. Not only did I get the IV fluids, but also drank like 2-3 liters of water, because they say it's very important to stay hydrated during chemo, and that helps like flush the medicine through and everything. So yeah, that was probably my biggest complaint all yesterday evening and last night, was just going to the bathroom like 100 times. And after you get the adriamycin, it is bright red, so they say it is normal to see your urine that color. Mine, I only actually noticed the color twice, and that was like when I was at the actual clinic. Before I had left, I was going to the bathroom, and the first 2 times after getting it, my urine did look like a bright orange. I guess probably not the red, because it was diluted with so much water that I was drinking. But since then, it's been back to normal. So it was only like the first 2 times I went. Side note. So yeah, no side effects, really. Now last night I did have a bit of a headache that lasted for a couple hours. I don't know if it's from the chemo. I don't know if I would have had it otherwise. I don't know. But still pretty mild, so far. I woke up this morning feeling a tad bit nauseous. I had to take my steroid again this morning and some more anti-nausea medication. And I was able to eat. Nothing tastes different so far. Tasted normal and fine. I still have an appetite. I think steroids help with that too. I'm going to start drinking my water again. I've also been taking, I've been drinking warm water with salt and baking soda, which is supposed to, or not drinking it, I'm gargling it, swishing it around in my mouth. I just keep a glass of it ready to go in the restroom. So every time I go to the restroom, I make sure to do that salt and baking soda water gargle. And then you spit it out. But that's supposed to prevent, or if you get mouth sores, it's also supposed to help get rid of them. But I guess mouth sores are a big side effect, or a common side effect on this AC chemo. So I was told to do that, and most likely could prevent them that way if I stay on top of it. So if I can prevent a side effect, I'm definitely going to try to do that. So like I said, I just keep it in there, and I make sure I gargle every time that I am in the bathroom. Just, it's an easy way to remember. Like, hey, the glass is on my bathroom counter. Every time I go in, just like you would wash your hands after you go to the bathroom, that's just another part of the routine. And then it's also important to do the rinse every time after you eat. I think it's just minimizing the bacteria in your mouth. So I've been doing that. I also started taking one Claritin because the day after AC chemo, I have to go in, so today, I have to go in and have an injection. I think it's called Neulasta. And basically, because the AC chemo can lower a lot of my blood cell counts, this shot is supposed to raise them, kind of counteract that. But one of the side effects is bone pain. So, this is supposed to how did she put it? It's like regenerating the blood cell counts and your bone density. I don't know. Maybe I shouldn't go too far into that, because I definitely need to research that a little bit more so I know what I'm talking about. But anyhow, what I do know is that this injection, the main side effect from it is bone pain. Pain in the bones, joints, whatever. So oddly enough, they told me Claritin, an antihistamine, apparently helps with that. So I also am taking the Claritin. So lots of medications to treat side effects of medications. It's a lot. I've never taken this many pills in my life. I just turned 32. I've never dealt with bone or joint pain for the most part. I am also diabetic, but on a day-to-day basis, I mostly feel healthy and active, so day 2, for the most part, very mild symptoms and side effects. Some I can't even say for sure are from the chemo, but I hope that I can continue feeling like this. I don't feel like I'm out of the woods yet, though, because I do see a lot of people say that they've started to feel really bad on day 3. So, I don't know. We'll see. I'm just going to try to keep on top of all the meds that they were given to combat these side effects. And hopefully, if I stay on top of that and the mouth rinse and take the Claritin, the steroids, the nausea medication, all that, hopefully I can get through this relatively, with just, mild symptoms. If I was only to feel what I felt yesterday and today, I would be very happy. So that's it. Hopefully this will help someone that's about to start AC. It's so far, it's not nearly as scary as I thought it would be. So I'll update after, day 3, day 4, see how things have changed, or if they haven't.